Welcome to Frankly Speaking About Family Medicine, a CME podcast series where each week we translate today's late-breaking clinical research and news into tomorrow's practice. I'm Frank Domino, professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School and editor-in-chief of the 5-Minute Clinical Consult series. Be sure to visit pri-med.com/podcast after the discussion for more information about today's article and to claim CME CE credit. Jane, a 53-year-old patient with type 2 diabetes and non-alcoholic fatty liver disease, is in for a checkup. She feels well, but is concerned about the appearance of her toenails. They look awful. She wants to know, can she take something to help prevent them from looking worse? You've diagnosed her in the past with onychomycosis, but you're concerned about prescribing an oral treatment given her history of liver disease. You consider prescribing a topical, but you're not sure how effective they are. Hi, this is Frank Domino, and joining me today is Dr. Robert Baldor, professor and the founding chairman from the Department of Family Medicine at UMass Medical School Baystate in Springfield, Massachusetts. Good morning, Bob.
Morning, Frank. Good to be here again.
Great. This is a really common problem and a very interesting topic. And in particular, we have some apprehensions about using the oral antifungals for this condition, and especially with people with liver disease. What are the topical agents available?
Yeah, so it's a good question. It's really interesting. I certainly have had patients that have been treated with these topical agents by the podiatrist, and I've not used them much in the past, so I was sort of drawn to this review. So there are, for the most part, three topical agents, and of course, Frank, you know how I struggled saying these generic drug names, and these are no different. But let's see if we can make it work here. The first one is efinaconazole. The second is cyclopirox. And the third is tavaborol. And so these are preparations, these are agents that are included in preparations that are specifically capable of penetrating into the nail. Now, efinaconazole, it's an azole antifungal, very similar to clotrimazole or fluconazole, and they inhibit the synthesis of the cell wall membrane. The other two actually inhibit the fungal protein synthesis, so they work in a little bit different fashions. But those are, for the most part, the three that are available for us to prescribe in the U.S.
I agree with you. I've not used these ever. What's this recent best evidence about these agents? What did they find?
Yeah, so, I find this fascinating. I love the Cochrane reviews. And what they did is they looked at 56 randomized control trials that were published between 1993 and 2019. And the primary outcomes that they used were cures, or sort of clinical cures, with resolution of clinical signs. And then a secondary outcome was negative mycologic testing, where it actually was culture to say they cured from the culture. They also looked at some treatment-related side effects. And of course, they started out with 56 studies, and ultimately they only ended up with 12 studies that they thought had reasonable data to draw any conclusions from them. The studies had people with mild to moderate onychomycosis, and often more than one toenail was affected. The treatment, by the way, ranged from 36 to 48 weeks, and the assessment was done up to 4 weeks after they completed the treatment. Now, the studies, for the most part, were all compared to the vehicle that was used. They didn't compare anything to oral therapy to sort of answer that concern or that question. So what did they find? Well, two studies looked at the cycloperoxide pyrox lacquer, and they found that they may be more effective than vehicle for achieving clinical and mycologic cure. But these findings were supported by low to moderate quality studies. Interesting, there were two studies, though, that actually did use a comparator, and these looked at using the cyclopyrox hydrolacquer, and they compared that to using the plain lacquer preparation, and they found that that was probably more effective than the cyclopyrox lacquer preparation in achieving the clinical cure, and those findings were supported by moderate quality studies. Now, they looked at a fluconazole solution, three studies there for that, and almost 2,000 participants in those in those studies. And they found that those were more effective than the vehicle at achieving clinical and mycologic cure. And those findings, moderate to high quality studies. So some pretty good results for that agent. And then finally, the studies of the taboborol looked at two studies with about 1,200 participants, probably more effective than vehicle at achieving clinical and mycologic cure as well. And those studies were moderate to high quality as well.
Wow. Okay. So we have some data that shows, at least compared to doing nothing or just doing the vehicle, these agents are probably effective at clinical and mycological outcomes. Um, but 48 weeks is a long time, and there's probably both cost associated with that and patient dedication to doing things. Are there any side effects to these topical agents?
Yes, it's really interesting because some of this was there were minor skin irritations and rashes and alterations seen in the nail color and shape. Although, this is compared to vehicles, so the vehicle is partly what seems to do this as well with it. But the treatments do need applied for almost a year. So what the authors concluded at the end of all this was they concluded that there's high quality evidence that supports the effectiveness of efinaconazole 10% solution. That was their number one. And then there was some moderate evidence for the efficacy of the cyclopyrox 8% hydrolacquer and the taboborol solutions. And so, the review looked at efficacy. So I went and looked at some of these my studies myself, and like most things, right, not everyone benefits. It looks like that on average, only 20 to 30% of patients actually achieve clinical cures in these studies. So better than the 5 to 7% seen with vehicle. Numbers needed to treat tried to tease this out. They appeared to range from 3 to 6. So not bad if you consider what we do for a lot of our treatments, but still really difficult to think about prescribing something like this and the needing to take it to apply it every single day for several months. And so did not address compliance issues, but certainly I think that would be part of the effectiveness as well.
So have you tried recommending these to any of your patients?
Yeah, so I've actually in the past have used the cyclopyrox, and I'm actually if this comes up again, I'm going to switch based on this study, and instead prescribe the efinaconazole for treatment. These are you know. Not inexpensive. I did look to see, about an 8-ounce bottle of this is on average probably around $1,700. It's in the realm of what we're paying for medications these days. I suppose isn't a lot for something you're going to for a year-long treatment. But based on this study, though, I'm going to switch and use that preparation because I think the evidence is there for the best efficacy with this product. So if we want to really use something and have patients apply this daily for a year, let's make sure we've got the most efficacious agent that we can. And again, it appears that this is the most efficacious out there.
Oh boy, that's an important part of the information to tell your patients that is, the bottle that's going to last the year might cost $1,700. Bob, very interesting data. This will be certainly changing how I approach things. And thank you for doing this review.
Thanks, Frank.
Practice pointer. When recommending topical antifungals for patients with onychomycosis, consider using efficonazole first line. Join us next time when we talk about the effect of shoe type on management of pain in osteoarthritis of the knee. Thank you for listening to Frankly Speaking About Family Medicine, brought to you by Pri-Med. To claim credit and receive additional information about the article referenced in today's episode, visit primed.com/podcast and see you next week.